they're choosing not to get the vaccine. And we're telling them that they can't work anymore. So we were totally fine using them as much as we wanted to when they didn't have an option to get treated and they didn't have an option for vaccination. But now that we've created a vaccine that doesn't seem to be working, we're telling them that if they don't get that vaccine, they don't have a job. That's so wrong.
It's actually not so wrong, Chels. It's actually quite right. If these healthcare workers you refer to truly did work during the peaks of this pandemic for the past year and a half and saw the horrors and atrocities that this virus causes, then there is no reason why they should not seek the vaccine for themselves. But I would bet that these are the same people who outside of work never wear masks, who don't respect social distancing, and who don't follow any mitigation measures. These are the same people who have done nothing to mitigate the spread of COVID in the community outside of the workplace. These are the same people who actively put their vulnerable patients at risk during every shift because of those behaviors outside of the workplace. These are the same anti-science healthcare professionals who likely didn't go into their role for the right reasons, who clearly don't utilize any critical clinical judgment, and neglect the basic principles of science and data that drive our practice. A good healthcare professional will do anything and everything in their power to protect themselves from illness and therefore protect their patients and their community from illness. But a healthcare professional who is seemingly incapable of understanding basic principles of biology and public health does not deserve to be in the field of healthcare and medicine. Patients deserve way better than that. And the entire field of medicine is far better off without any of them here. And by the way, vaccines do work. In my link tree are listed numerous studies that demonstrate the effectiveness of the vaccines in a clinical trial setting, in the in vitro setting, and in the real world setting at preventing symptomatic illness, hospitalization, and death. And just look at the states in the US where vaccination rates are the lowest. That's where hospitalizations are the highest.